Hey, it's Dr. Shawn Nabors, West Michigan anxiety specialist and practice owner of the Anxiety Treatment Center of West Michigan. When you're working with an anxiety specialist, you are working with someone who day in and day out treats people with anxiety disorders or anxiety related disorders. So like any specialist, they have a wealth of experience seeing that issue present to them in a variety of different ways. Anytime I treat a new client who has an anxiety issue, I am never treating any situation or disorder, anxiety disorder, that I have not seen before. For example, if someone is presenting with social anxiety disorder and panic disorder, but they only experience it in very unique situations, I've had tons of experience treating not only their anxiety disorder, but also I've seen how their issue manifests in that specific situation from other clients I've treated throughout the years. But when you work with an anxiety specialist, it may feel like you have a very unique form of anxiety that maybe your therapist won't understand, but as specialists, we've seen anxiety disorders manifest in a variety of different situations and are very skilled at identifying that and treating it. Anxiety specialists are highly skilled at giving you very specific anxiety diagnosis. If you go to your doctor and you tell them that you have anxiety, you're typically going to get a diagnosis called general anxiety disorder. If you see a counselor and they are working with you on your anxiety, they're probably just going to say that you have anxiety or diagnose you with some type of adjustment disorder, but it won't be really specific, most likely. When you work with an anxiety specialist, you will get a very specific diagnosis for your anxiety and what type of anxiety that is. Under the umbrella of anxiety disorders, you have a lot of different specific types of anxiety disorders: social anxiety, panic disorder, general anxiety disorder, and so forth. And then you also have a bunch of anxiety related disorders under that umbrella. Now also, when you work with an anxiety specialist, you are also going to be working with someone who is going to walk you through your anxiety issue in a very structured way. Typically, some type of evidence-based therapy will be delivered that will walk you through skill development to be able to handle your anxiety issue and be able to restore functioning in areas where your functioning has been lost because of the anxiety disorder. And my favorite thing that I like to offer when I'm working with clients as a specialist is a feeling of competency. When my clients come to see me, I like to let them know that I thoroughly understand your issue. I have a detailed treatment plan for your specific issue, and here's how I've walked other clients through that same issue. So that's another thing that clients like when they work with an anxiety specialist. Overall, you don't need to specifically work with an anxiety specialist for your anxiety. A therapist who specializes in a lot of different other issues can help you. However, you're probably going to gain a lot of traction a lot quicker working with a specialist simply because that's all that they do. That's what it's like working with an anxiety specialist. And as always, thank you for stopping by and take care.